Hey guys, it's Dr. Andrea Huddleston here. Welcome back and thank you for joining me. On this video, I want to talk about the role of the position of your uterus and an increased risk of period pain. So you actually did hear that correctly. So what I want to talk about right now is where your uterus is actually sitting within your pelvic bowl, which is usually either an anteverted, a forward tilting position, or a retroverted or a backwards tilting position, actually increases your risk of more severe menstrual pain. I'm going to go through a lot of detail about different positions of uteruses and everything else in other videos. But for this one, I want to look at some studies around that uterine position and increased menstrual pain. So about 80% of women have an anteverted uterus, and that is, a relatively normal thing. Anatomically, it should sit in a slightly anteverted, so slightly forward tilt. However, it should be freely movable and it should be pain-free. When we have a fixed anteverted uterus, this can actually cause pain, period pain, blood pooling, obviously severe cramping during menstruation, difficulty with pap smears, IUD insertions, and can even have fertility implications as well. The other percentage of the population, so the other 20% of the population have a retroverted uterus, so that's a backward tilting uterus, and often that is usually more associated with severe symptoms and really chronic issues such as endometriosis as well. And we'll talk about that in future videos as well. So the study I'm referring to at the moment looks at the relationship again between menstrual pain and the degree of flexion of the uterus. So what they did with this study is they took 278 women and they were assessed using transvaginal ultrasound and bimanual gynecological examination. And they did that over a 2-year period. So it was quite a long time to actually sort of assess these women. And what they found is that the position of the uterus was an independent risk factor for intense menstrual pain, which means that the position of the uterus alone can cause really severe period pain. And the key points I want you to take away from this are that menstrual pain, intramenstrual pain, so pain between the periods, and dyspareunia, let me say that again, and dyspareunia, which is pain during sex, are actually related to uterine version, so either anteversion or retroversion. And uterine anteversion and retroversion are associated with chronic pelvic pain, again, pain during sex, and dysmenorrhea, so severe menstrual pain. Importantly, this study excluded any participants who were on hormonal contraceptives or had ultrasound evidence of fibroids. So I think that this is really important to note that there were no other factors that they identified that could be the source of this pain. And again, uterine position was found to be independent of childbirth or pregnancy. So irrespective of those other factors, that position that related to the pain and the degree of flexion, so how much the uterus is flexed or retroverted on that is increasing that pain. They also found that surgical repositioning of the uterus actually reduced the pain. However, there may be other options for that, and hopefully surgery isn't the only option for these women. What we did find is that the intensity of menstrual pain, again, was significantly different among women with the highest values of uterine flexion, so the most degree of tiltage. So I want you to have a think about that. Why do you think that, say, a really strongly anteverted or strongly flexed uterus will increase menstrual pain and intensity? And what we know is that as the uterus tilts forward within that pelvic bowl relative to the cervix, it's actually, that angle creates almost like a valve between the uterus and the cervix itself, and it closes that valve, which means that when you're discharging, essentially menstrual tissue during bleeding or your period, we have to have stronger myometrial contractions, so stronger contractions of the actual uterus itself to expel that blood because of the position. So those myometrial contractions is the cramping that you're feeling during your period. That is the increased period pain. Isn't that amazing? And there are actually tools that I will teach you to try and reduce that degree of flexion or anteversion at home. And that tool is called a uterus lift. So stay tuned for the video on that specifically, because you can do that at home. So guys, I'm Dr. Andrea Huddleston. Thanks for joining me. Make sure you subscribe below and feel free to check out Hormonal Mastery as well. Again, it's my holistic guide to hormonal balance. You can find that on Teachable, and I do go into a lot of detail about period pain, the causes of that, and also tools and techniques to address it on there. Thanks.